This will be our last Contemporary Issues video module. Next time we'll finish up with a look at the future. And this one's about workforce issues. I'm guessing that for those of you out there who may be thinking about entering the field of pharmacy, this may be an issue that's of significant concern to you. It should be. Let me start off by just saying in general that the job market for pharmacists has tightened. But it still, in my opinion, looks good. The future looks promising. We're going to look at some data that will support what I've just said. But having said that, I work in a college of pharmacy where, students are graduating every year, and I know that there's growing concern among our students that will they get that dream job that they really wanted, and that has become more of a challenge in the last 10 years or so. I want to kind of draw us back to what we talked about earlier in the course when we talked about career decision making and stress the importance of what we call the vigilant decision making process. The job market has changed, our opportunities are shifting, things like patient-centered practice are kind of becoming more prominent, all these kinds of things we've talked about in this course. It really requires you to be proactive and to be vigilant in terms of how you prepare yourself for these changes and how you seek them and how you kind of network with people in the field and on and on. So I encourage you to understand that the job market's changing, but to prepare yourself differently to get that dream job that you want in the future. Well, take a look at a couple of resources that could be helpful to you. One is called the Pharmacy Workforce Center. This was formerly called the Pharmacy Manpower Project. It is a conglomeration of many of our pharmacy associations that have really done a quite nice job of kind of looking at the workforce, predicting where we are headed, in terms of the supply and demand side of this equation. And I think we've done a really good job in this profession of really paying close attention to this. They do this thing called the Aggregate Demand Index across the country, and they also drill it down regionally, by the way, as well, and to state level even. And so they have a panel of people who hire pharmacists across the country, and they survey them periodically to just determine how difficult it is to find and fill pharmacist positions. And what we find is they use this kind of range, these numbers from 1, meaning there's a high surplus of pharmacists, to 5, meaning there's a high demand for pharmacists. And you'll see that right now, the latest national figure that came out was May 2013. That ADI number was 3.2, which really means that 3 being in a situation where supply and demand are pretty much in balance. That seems to be where we are. I want to show you the change in this aggregate demand index in the past year. So we looked at May 2013, it was 3.2. We looked at the previous month, it was 3.1 in April. If we looked at May a year ago, it was 3.26. So there's been about a 0.06 negative change in that number headed toward the center. But again, we seem to be hovering around aggregate demand index of around 3. Meaning that supply and demand are pretty much in balance. I want to point out a couple of other predictors that might be of interest to you. This one was actually published in 2002 by David Knapp in the American Journal of Pharmaceutical Education. I've got the reference there in case you want to look at it. This article is entitled Professionally Determined Need for Pharmacists in 2020. And what they did in this projection in their research was find that they projected a shortfall of about 157,000 pharmacists by 2020. So that sounds good if I'm wanting to enter this job market. If we look at the kind of the devil in the details, however, and this should be no surprise to you, understanding what we've learned in this course, is that they predict a significant decreasing demand and need for order fulfillment, meaning less pharmacist time, fewer pharmacists involved in getting products to patients and dispensing, and a significantly increased demand in pharmacists' need for what they call primary, secondary, and tertiary services. Primary meaning outpatient services that are providing patient care services like medication therapy management in a community practice setting or collaborative practices. Secondary and tertiary services meaning hospitalized services which are more specialized, or acute care, and also the oversight of medication safety systems institutions as well as drug policy. So, here's some good news. They're predicting that in the year 2020 we might have a pretty significant shortfall of pharmacists, but understand that the devil in the detail is that where these pharmacists will be working is changing pretty dramatically, going to more patient-oriented services and away from order fulfillment services. Another kind of prognostication piece for jobs is the U.S. Bureau of Labor Statistics. They have a thing called the Occupational Outlook Handbook. This is data from the 2012-2013 edition. You can go to online and Google U.S. Bureau of Labor Statistics Occupational Outlook Handbook and find the outlook for many occupations, not only pharmacy. It might be of interest to you. Here's some information from their current look at pharmacists. First of all, the median pay in 2010 looked pretty good. Over $111,000 per year, about $53 to $54 per hour. So, that sounds pretty good if I'm looking toward an occupation. The number of jobs in 2010, they said, was just about 275,000. And then they have a look toward the future, and they predict that between 2010 and 2012 there would be a 25% growth in this field in terms of jobs, faster than the average for all occupations. Again, that's, I would think, positive if you're looking at this toward a profession for you in the future. And that employment change amounted to about 70,000 additional jobs by 2020. And then I want to also complete this discussion with another kind of piece of work that kind of predicts where we're headed in terms of workforce needs in this field. This is from the United States Department of Health and Human Services. It's called the Health Resources and Services Administration, or HRSA. They have a document called the Adequacy of Pharmacist Supply 24 to 2030. And in this one, they say several things. One, the supply of pharmacists is growing significantly faster than previously projected. We know that the number of colleges of pharmacy is growing significantly. Therefore, the number of pharmacy graduates is growing significantly. And this has changed a lot in the last 10 years or so. They suggest that the demand for pharmacists also continues to grow. And this is a result of the changing demographics in the country. We'll talk about that here in a minute. Basically getting older in terms of the mean age or median age of the population, that we have new drug therapies that require more intense kind of pharmacist involvement, that we are increasing medication therapy management services. That could drive an increased demand for pharmacists. But there are some other things that could modulate this, things like the use of technicians and the use of technology. Think about telepharmacy that we talked about earlier this week. This could change the demand for pharmacists based on sharing of staffing personnel. They also say that there is currently a moderate shortfall of pharmacists. So we're at kind of a balance of supply and demand, perhaps with a moderate shortfall. So, again, that's good in terms of job seekers. And then finally, this adequacy of pharmacist supply by HRSA makes this statement, that the future supply of pharmacists is projected to grow at a rate similar to the projected growth in demand from changing demographics. And here I have a little picture of old Dr. Hale in his retirement getting ready to go out and take his walk in the park. We're getting older, we take more medications, the demand for our services is likely to go up in this changing demographic. So that the supply of pharmacists is projected to grow, but the demand is projected to grow as well. Here's our pharmacy fundamental, one of the pharmacy fundamentals for this module, and that is the Pharmacy Workforce Center. I've defined this for you as a nonprofit corporation whose mission is to serve the public and the pharmacy profession by developing data regarding the size and demography of the pharmacy workforce and conducting and supporting research in related areas. This is from aacp.org. I invite you to use the pharmacy workforce as you consider your future in this field. This workforce is supported, I think I mentioned to you earlier, by a number of the associations that we've discussed this during the course. In fact, most of them. There are like about a dozen or more associations involved in developing and operating this center. The discussion forum question I'd like you to think about, and this one I think you're thinking about already if you're mindful in terms of where you're headed in the future. What concerns do you have about the pharmacy workforce picture? Well, what are the things you're thinking about in terms of the outlook for you in this field? And what factors do you see which could impact the relative need for pharmacists in the future? I think some of the things we've talked about during this course could dramatically change the need for pharmacists based on more intense patient care operation, maybe more intense technology usage, telepharmacy, and so forth. What concerns do you have? What factors do you see that might impact those concerns? I look forward to our next and final video content recording as we look a little bit more intently at the future.